Good morning. I have a very short presentation on protecting ourselves from bloodborne and airborne pathogens. This is a very important topic that we all should pay very close attention to because this is a very real scenario that could happen to any of us at any time. The question is, are we going to recognize it? And are we going to be able to protect ourselves from it? And if we don't protect ourselves from it, what could potentially happen? There is a plethora of different diseases and illnesses and communicable processes that could happen if we don't take the right amount of precautions. So let's get started. So today as we said, we're going to talk about bloodborne and airborne pathogens. So the objectives of today is to describe the difference between bloodborne and airborne pathogens. How to minimize our risk of exposure. We're going to discuss the different risks and pathogens. We're going to discuss the different types of PPE we can use. And we are going to discuss what we can do if, inevitably, unfortunately, we are exposed. So first of all, what are we dealing with here? So what are the organisms that we're dealing with? So specifically the disease types of organisms are viruses, your cold, your flu, that kind of stuff. And then bacteria, that kind of stuff. Fungi, parasites, all of these things can make us potentially very sick. And all of these things we can protect ourselves against. If you've been in this more than a day or you survived through the COVID pandemic, we've learned that there was something to do with social distancing, mask wearing, N95 use, how to prevent that. And when it all comes down to the end, vaccines. So let's move forward. So when we're talking about infectious disease and communicable disease, infectious results from the invasion of a host by a disease-producing organism. So, which is different. In a communicable disease, it's disease that can be transmitted from person to person. Can a communicable disease be an infectious disease? They're kind of intermingled. Yes, but how you obtain the disease route is different. So modes of transmission, we're looking at what different ways can it get in the body. Directly, it can be transmitted with direct contact with blood or OPIM. OPIM, that's going to be a buzzword, a buzz phrase you're going to see throughout this, more to come, of an infected individual. So direct contact with blood or OPIM of an infected individual. So then indirect transmission, disease organism passes from an infected individual to an inanimate object, then the person touches that object. So I work on this scene. I have blood on my hands. Multiple patients are down next to this. I get blood on my hands. I take care of one patient. I move to the next patient. I don't change my gloves. Hence, here we go, indirect transmission. He's the provider, I would imagine, as an EMT, is walking through the blood. So wherever he goes and walks, that surface that he touches is contaminated. So cross-contamination. So the portals of entry, this is the route through which a pathogen enters the body. So as you see here, he's rubbing his eyes. Don't do that. So open wounds, insect bites, ear, nose, and mouth, or any mucous membrane. So if you're on a call and you got gloves on and your eye itches and your nose itches, guess what you don't do? Don't scratch your eyes, rub your eyes, don't scratch your nose. That will have to wait. If you absolutely have to, you have to take the gloves off, you have to clean your hands and then do it. Avoid it if you can. If you're properly protecting yourself, the access to be able to do that is probably limited. And it never fails. Once you put an N95 mask on, within 30 seconds, your nose will itch just because that's what your mind plays games with you with. So the moral of this story, in your work areas, don't eat, drink, smoke, apply cosmetics, no lip balm. Don't handle your contact lenses in the work area. So if you are working on Thanksgiving, which is coming, or Christmas, which is also coming, and you get a big plate of food and you get a call right before you start to eat it, and you say, I'm going to take my food with me, great. Don't eat it in the ambulance. Make sure it's covered. Wait till the call is done. Remove yourself from an ambulance. Put yourself in the clean place that you can eat, and then eat it. Inside the ambulance is notoriously dirty, one of the dirtiest spots you could possibly eat. So, what are bloodborne pathogens? Bloodborne pathogens are any disease-causing microorganisms, viruses, bacteria, fungi, etc., that may be present in the blood, or OPIM. Are you ready for it now? OPIM, other potentially infected materials. You were waiting with bated breath. I know you were. There you go. Remember that. That'll pop up several times. OPIM, other potentially infected materials. These include, what's that? Yes, you're right. Hepatitis B and C. This has been around since before I started doing this job. This has been around since everyone started doing this job nowadays. But what else? HIV. All of these have been around. They're going to be around. They're not going anywhere. So HIV is a human immunodeficiency virus, which we all know leads to AIDS in the long run. This is dangerous because we don't know who is actually contracts HIV and is positive for that, because they don't have active symptoms with this. You can only find out through testing. Hence, once they start having symptoms and they're diagnosed with AIDS, it's too late to actually, well, not necessarily too late, but we need to identify this before so it doesn't spread. That's the take home for that. HIV, that's why we're careful with anything we touch, that we're protecting ourselves, because you don't know who has a hepatitis. You don't know who has HIV. You have to protect yourself. Malaria. Oh, that's never going to happen here in the United States. Of course it does. Of course it does. So it just needs an infected mosquito. Florida. Yeah. Did I say that out loud? Oh, yeah. Well, anyway, syphilis is not gone yet. It's still around, and it does have transmission spikes that you'll see across the country. This is what the CDC studies, and they identify. So what are other potentially infected materials, infectious materials, excuse me? So let's look at it. CSF, cerebral spinal fluid. Saliva, potentially. Sputum. Saliva and sputum, are they different? Yes, because remember, saliva is what we use for mastication, or part of our digest process when we're chewing, and then the saliva starts mixing with the materials that we're chewing, starts to break them down, to move and to slide down. Sputum is what is produced by our lungs and the mucous membranes around that. Tears, potentially. Vomitus or emesis. Urine. Semen or vaginal secretions. Feces. So all of these things have something in common. They're all liquid, wet, moist things that are produced by the body. So basically, if it's wet and it's not yours, you shouldn't touch it. If you have to touch it, you should protect yourself. More to come. More to come. So when we talk about HIV, or the human immunodeficiency virus, things we need to know. There's no vaccine available. incubation period can be as 8 to 20 years, huge range. And this is a sneaky one because there's no specific symptoms, and the only way we can do it is by testing. Testing is the only way to determine infection. And this is infected through blood. Oh, there it is again, or OPIM. So when we're talking about HIV, we have to talk about AIDS. This is caused by the HIV disease, the virus. So symptoms: night sweat, weight loss, fever, fatigue, glandular plainness, swelling, muscle or joint pain, a rash. So this also, don't discredit symptoms you've had with the flu or COVID or anything, because you don't have to have all of these symptoms to do that. And if you look at those, these are similar to other illnesses, being viral or bacterial, that people could contract. So bloodborne, right? So while we're talking about that, let's talk about hepatitis. Hepatitis B is the inflammation of the liver. This is caused by drugs, poisons, and bloodborne pathogens. So it's introduced through the body somewhere, maybe a needle stick, and there's different types of hepatitis, but B is the one we worry about the most because it's the easiest to contract. So incubation period is 12 weeks. 12 weeks. So we could also, you're exposed and you're like, oh boy, I should be worried about that. And then you know what? Time goes by and you're like, woohoo, I didn't get sick. And then 12 weeks later, you start to develop these symptoms of liver deficiency and failure. Tracks it back to that time. So that's why it's so dangerous for IV drug users, because they can't determine when exactly, potentially, if they're using multiple times over that period of time, to exactly when and who they contracted it from. So, but it's not isolated to just IV drug users. This could potentially be transmitted in a hospital environment. It could also just be somebody that is immunocompromised, just by handling other people's blood, or even if they didn't know it was. So, but symptoms of this: jaundice. Jaundice is, if you haven't seen jaundice yet, this is one of those things you'd be like, aha, that's jaundice. It is so obvious. Their skin is just how this person looks. I mean, their skin is like a sickly orange yellow. Their sclera of their eyes are just yellow, very, very thick looking. Jaundice, fatigue, abdominal pain, or where's the liver, and the loss of appetite, nausea, vomiting. These can potentially be very sick people if you can remember what your liver is for. So, yeah. Hepatitis B is able to survive outside a host for at least a week. So when we talked about, I don't know where I got this, and we talk also about cross-contamination and not protecting yourself, eating in the back of the ambulance. All of these things can come into play because it can survive. This virus can survive outside the body for a prolonged period of time. A week is huge. A week is huge. Now, all of you probably have heard about this. MRSA it's in the news. It's in your lives. It was in your schools. It's literally, it's a very resistant virus. So methicillin-resistant Staphylococcus aureus. That's 6 times fast. This is a very common bacteria. It becomes life-threatening when you're resistant to antibiotics. So there's people out there that run to the doctor every time they have a scratchy throat, and they say, give me penicillin, or give me antibiotics for that. And if they have a doctor that says, okay, here you go, this is what it can lead to. That's not just the only scenario. The other scenario is somebody that is acutely, chronically ill and are constantly in the hospital and constantly have to receive antibiotics because their body is not able to fight infection. They are very susceptible to getting MRSA. So MRSA is very, very common to be transmitted in a hospital environment. Oh, look, it's almost as if I knew that next bullet point was coming. I didn't, but I did, because, you know, I wrote this. But anyway, talking more about MRSA, causes of infection are different in different areas. So it could be through the skin, through the nares of the nose, through the bloodstream, through the lungs, through the urinary tract. And with these entry points, they will have different symptoms to go along with that. So how do we protect ourselves? What do we do to prevent? Well, here we go. We talk about BSI, seen safe, right? Great. So when you think about BSI, think about what BSI you're going to need, because every patient doesn't get the moon suit. Some patients just get gloves. Some patients get gloves, gowns, N95s, facial protection, hair protection, and the whole 9 yards. So appropriate BSI for the situation. So when you say BSI seen safe, don't be offended when somebody asks you, what BSI are you currently wearing for this respiratory patient that has COPD and is doing breathing treatments? Think about that. And then obviously hand washing. The biggest prevention we can do for any transmission or lack thereof is hand washing. But let's go into the airborne pathogens. So an airborne pathogen is any disease causing microorganism, being virus, bacterial, or fungi, etc., that is spread by droplets expelled into the air. That's airborne. Just how it looks like that. Cover your mouth when you are coughing, right? Makes sense. Keep it easy. These include tuberculosis, meningitis, varicella, or what the heck, chickenpox, right? But chickenpox also, you could get that as a kid. You can also get that as an adult. Question to yourself, who could potentially be worse, the child or the adult, if they get chickenpox? The answer to that is the adult. Actually, it tends to be a lot sicker. They have a lot more respiratory stuff with that, because chickenpox literally can be in their lungs and in their airway. It doesn't tend to happen that way with kids. So, but shingles is a variant of that. So that is something that as we get older, we get our shingles series of shots to avoid that. Very uncomfortable for the patient. Again, could potentially be harmful to them because of where the infections. The shingles is usually extremely itchy, extremely painful, following the nerve routes. So on the back. So measles, mumps, flu. Here you go. You waiting for it? Don't forget about the big one, COVID. If you forgot about that, you've literally blacked out the last 3 years, 4 years, whatever it takes. So, but let's obviously we can't get into all of these, but let's specify a few of them. One of the things that we deal with is tuberculosis. You can potentially deal with that. This is serious and often fatal if it's not treated. So this requires very close contact to a sufficient number of air droplets over a longer period of time in infection. So think about which patients are susceptible to this. Through the years, they've had homeless shelters that literally were big, huge open buildings with beds sitting right next to each other. Tuberculosis was very common to that. Back before they really knew much about it, hospital settings were also common about it because of the same story. Big open room with beds sitting right next to each other doing it. So that prolonged period of exposure to that we can protect ourselves from that. This is another. N95s are huge. We should be wearing them more often, and going from there. So this is anything airborne that you suspect airborne. So if somebody has a cough and cold symptoms, you should probably protect yourself with an N95 and gloves, at least gloves, because this person, we can point a finger and say, oh, it's probably a cold, or is the other thing. So tuberculosis, what symptoms they have? They have weight loss, fever, night sweats, coughing up blood, otherwise known as hemoptysis, or chest pain. So sound familiar? That's why these are just symptoms. You have to pay attention when you interview and when you assess and you find these findings. You got to ask yourself, where does it fit? Which differential diagnosis does it fit in? If it fits in multiple, treat it as such. Protect yourselves. If you get sick and you come to work sick, you're going to get everybody else sick. And potentially, especially if it's something like tuberculosis, or if it's something like COVID, or if it's something like the flu, it could at least put a huge impact on the EMS system you currently work in. Or at the most, it could be potentially career ending or life threatening for you or those around you. So when you wake up with a sniffle, run that through your thought process. Is this appropriate to expose other people to or not? So COVID-19, these numbers are old, sorry. But we all know that COVID-19, since it's been started, has been extremely fatal to large populations, especially immunocompromised elderly. At this time, I don't have the new numbers. As you see, this is April 14th. The new numbers actually, as we move forward, vaccinations are actually higher than that, but they're also dwindling off because people are not going back to get their boosters. And, the media doesn't help either by saying, well, this causes this and this causes that. Great, thanks. You do great. So it's something, make sure if you're getting your vaccine, you take all of the information and utilizing that by educating yourself. If you decide not to get it and you haven't gotten it yet, this late in the game, there's that. If you've gotten your vaccine series and then you've gotten your boosters and you don't know if you want to do your boosters, look to the data, look to what's going on with the current boosters. Educate yourself. That's all we can do. So this list gets larger and larger and larger and larger. So if somebody's sick, we don't know what they're sick with, you can always fit COVID-19 right over the top of it. So fevers, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of smell or taste, a sore throat, congested or runny nose, nausea and vomiting, diarrhea, a bad attitude, boredom, financial distress. The list goes on and on and on, depending on who you are and how you took it. So if you were working through as a frontline person during COVID, being in the medical field or whatever field you were working in, kudos to you. A lot of you that are watching this may be new to all of this. When COVID hit, I think we all had in the back of our heads, that kind of thing will never happen to us. Even with the big Ebola scare that we had, we prepared ourselves, but never going to happen to us. Then COVID hit and it was eye-opening. And suddenly all this stuff we talk about in a presentation like this came to the forefront. And we were able to deal with it because, you know what? We were already trained to deal with this. We just never thought we would have to deal with a scary thing like that. We survived through the unknowns and moved forward to dealing with this on a daily basis and realizing that we're going to survive this because we don't have a choice. We'll move forward to do that. So knowing all of these communicable diseases that are out there and transmittable diseases, how do we protect ourselves? So what do? We protect ourselves with what does the PPE do for us? So it provides a barrier, provides that barrier. So it includes gloves, masks, protective eyewear, gowns. The mask could be as simple as, it might be, depending on the situation, a surgical mask, which really doesn't protect you from much, protects others around you, because if you're sneezing and coughing, it keeps those droplets from going all over. However, you get up to N95, P100, the list as it goes up in quality of mask depends on what it could protect you from. Protective eyewear, mucous membranes, people, mucous membranes, accessible through your eyes. Gowns, blood, sputum, everything. You don't want that on your clothing. You don't want it on your skin. Protect yourself and go from there. So let's talk specifically about these. This is going to maybe review. Also, you might actually say, hey, this is kind of common sense, but let's talk about it anyway. So gloves, people, they are single use only. Remove as soon as possible after you do patient care. Use extra care to prevent skin contact with contaminated gloves. During the pulling off of the glove, holding in one hand, pulling off of the other. It's an acquired skill that if you haven't practiced it yet and you haven't seen it yet, sit down with somebody and work on safe glove removable. Dispose of properly for the SOPs. Properly is in a garbage can in a patient care area. If you're working on an ambulance, you have your gloves on and you get out of the ambulance to go drive the ambulance to the hospital and you still have your gloves on, and you touch the steering wheel, you've cross-contaminated onto the steering wheel. If you've gotten out of the ambulance and you take your gloves off on the way up to the front of to go drive, and you take your dirty gloves and you throw them in the middle where everybody's drink bottles are, you've cross-contaminated. And also, it's not very nice to your partner. If you have in the back of the ambulance standing at the side door, take your gloves off, put them in the garbage can, get some hand sanitizer, wash them on your hands, step out of the ambulance and only touch the outside of the ambulance, you have gone down the right path. If you get something wet and it's not yours on the glove, let me rephrase that. If you get something wet on the glove, because even if it's yours, you still need to protect the patient, change your glove. So if you get blood in your glove because you were suctioning, or not blood, emesis or blood or sputum, change your gloves, because remember, it's cross-contaminated. A severely sick patient, put 2 pairs of gloves on, because if you're under a lot of stress, your hands will sweat because they have no aeration and they will become sweaty. So it's very difficult to get a new pair of gloves on over that. But if you double glove, you always have a barrier underneath. The gloves will slide right over. So whatever glove fits you, and maybe you could do another size of your size, or go up a size to double glove, and it does wonders. It's a game changer. So, and then wash your hands as soon as possible after removing them. So if you're getting out of the ambulance, hand sanitizer to start, and then at the hospital, when everything's cleaned up, wash. Soap and water, at least 30 seconds of vigorous scrubbing. Wash those mitts. And as my first grade teacher, those hot cookie crumblers, he used to call them. It's funny what we take home with us all these years later. Hot cookie crumblers. Go ahead and use that one. So talking about masks, the splashes. We want to use masks, and then if they're splashing, we want to protect their eyes too. But we'll talk about that in a second. But then there's surgical masks for blood and OPIM, and N95 masks for airway precautions. So if you have somebody that you're giving a breathing treatment to, for you guys, on a basic level, be albuterol. Remember, any breathing treatment, especially if it's nebulized, any germs that they have in their lungs will now be aerosolized, attached to fluid droplets and expelled into the room. And if you're there to inhale them, it's that much easier to be exposed to it. So if you're doing these treatments, protect yourself. N95 goggles. If you can wear a mask, wear a gown, you should, and then gloves. So when it's done, feel free to remove them. However, if they're having a respiratory problem, N95 should definitely stay in place because you don't know what that is. But if you already have everything on, don't take it off until you are in a safe space. Eye protection, whenever there's a possible exposure to the eyes, intubation, childbirth, gown should be worn if there's a possibility of body fluids and droplet exposure. All right. Regulated waste. What are we doing with that? This is liquid or semi-liquid blood or OPIM. This is what goes into these containers. Items contaminated with blood or OPIM, contaminated sharps container. When the sharps container is full, it gets sealed. It goes into one of these. When these get picked up, they go to be incinerated. Waste containers must be labeled with biohazard symbol or color-coded fluorescent orange or red, orange or red. Sharps. Any contaminated sharp object that you could potentially, that has broken the patient's skin and could also break your skin. So needles, scissors, broken glass. That's something you got to worry about in the back of an ambulance? Absolutely, because some of the medicines we use come in what's called an ampule. Break that ampule open, 2 shards of glass, one on each end of the broken part. They can cut you, they can cut the patient. If you cut yourself while you're opening this on your thumb, which happens to almost every new paramedic, you now have contaminated glass. Don't go drawing the epinephrine up out of that. Dispose of the whole thing, wrap your finger up, put a new pair of gloves on, start over from scratch, and don't cut yourself this time. So, because if it's contaminated glass and you go draw that epinephrine up out, even though you can't see what's in there, just the process of drawing the epinephrine up now has contaminated that, and you could potentially inject the contaminated fluid into the patient, and whatever you have, now they will have. Good job. Go home. You'll sleep good at night for that. So don't use your hands to clean up broken glass. That's what a dustpan and a broom is for. Even better, a vacuum. If you have a shop vac available in your station, that is what you should be using. So don't recap your needles. Enough said about that. Just don't recap your needles. When you're done with a needle, it goes into sharps containers. In a sharps container, if you have to remove the needle from the end of a syringe, you'll see there's a spot to actually insert the needle into, and it catches the bevel of the needle, not the bevel, the hub of the needle. You twist it off and then drop that into the sharps container. Most of the sharps we use, the whole thing just goes right in the sharps container. Or it's also safety needles that we're using a lot. So let's talk about exposures. So eyes, mouth, other mucous membranes, open wounds, or parenteral, I can say that 6 times fast, parenteral, there you go, contact with blood or OPIM. So we're going to, parenteral is any contact from an outside source that is infecting your body. So during when AIDS was huge and we didn't know enough about it, a new law started by the Ryan White Comprehensive AIDS Resource Emergency Act in 1990. So this is a public health law. The notification requires requirements allowing response personnel to find out if they have been exposed to an infectious disease. This does not authorize mandatory testing of patients for infected disease, because we can ask, can you please do that? So notification provided by the treating facility where the patient has, when a patient with airborne communicable disease has been transported, or any communicable disease for that matter, must be made within 48 hours. This only applies to transporting crews, not to the on-scene responders, So also, if we request it, if we have a notification by request, We can be made by any member who attended, treated, assisted, or transported a patient where exposure may have occurred. This covers the on-scene personnel, and it's made through a designated officer. So every agency we work for has a the Ryan White officer, or might be called the exposure officer. I know ours does. If you don't know who yours is, wherever you're going to be working, you should definitely know that. Know the process and procedure for reporting a procedure too. So the take home for today, if this is a lot of stuff, I covered it in a short time. It was just a few slides. It doesn't cover the entire spectrum of bloodborne pathogens. Remember this: if you walk in and you say BSI scene safe, that's great, but you got to know what is the BSI that you're going to use. So, big rule: if it's wet and it's not yours, don't touch it unless you're protecting yourself. If you have questions, that's great. Please feed them back to me through the appropriate personnel. I'll be more than happy to field anything. So other than that, that's where we are today. I appreciate your attention today, and we'll see you on the next one. Take care.